if you really have to go, then please be aware, check, all the details and make sure that, that you are going to be safe wherever it is you're going to. And as much as possible, get some of your, networks, your friends, family, let them be aware of where you're going to, so that they can keep tabs on you should in case you need, something will pop up and you need help. Okay, at least they will be available to help you at that point. Just basically stay aware and keep safe in these times. Every single day we hear of really terrible news in the social media and wherever else. So we crave your indulgence to keep yourself and your loved ones safe. Okay. So now I'm going to hand over to our dear section chair, Priscilla. Priscilla.
Hi, Uju. Thank you. Hi, everyone. Good morning. It's such a pleasure to have you join us today for this webinar. I'm glad that we finally get to have this webinar today, even though it was initially scheduled to happen last month. And this was because the month of October was designated as the Pink Month as part of the global effort to create awareness for breast cancer. So it's a pleasure to have an expert in this field talk to us. So thank you, Dr. Elima, for coming to talk to us on the risk factors, screening and treatment guidelines of breast cancer in Nigerian women. I have no doubt that it's going to be 1 hour well spent. So welcome, everybody. Please continue to follow SPE Lagos on all social media platforms to engage with us and get up-to-date information about all our programs. Thank you for joining. So now I hand over to the experts. Uju, over to you and to Doctor. Thank you.
Thank you. Thanks, Priscilla. So just before I introduce Dr. Elima, I just wanted to mention that, I was curious to understand why specifically is breast cancer being, given a whole month, So I went through a couple of research and I could see that, out of all the number of, different kinds of cancer, lung, cervical, and whatever else that is out there, breast cancer comes tops as one of the, the big ones, that really deals with us as human beings. So I was really excited. So I see that every single year, October is dedicated to breast cancer. And again, the point or the objective of doing that is basically to keep raising the awareness, keep getting people to know that early detection is very key. Managing your lifestyle and, all of these things is very important to minimizing your risk of getting cancer. So today we have, our dear Dr. Elima Jedy-Agba, and allow me to introduce her to you. So I'm going to read her bio as quickly as possible, and then she can get on with the presentation. So Dr. Elima Jedy-Agba is a cancer epidemiologist and the coordinator of the International Research Center of Excellence at the Institute of Human Virology, Nigeria. Medicine and surgery at the University of Calabar, and has a master's degree in public health and a PhD in epidemiology and population health, all from the London School of Hygiene and Tropical Medicine. Her previous work was largely based or focused on improving cancer registration and surveillance in Nigeria. She is keenly interested in early detection of breast and cervical cancer, prevention in sub-Saharan Africa. She was a recipient of the 2020 International Innovation Grant from the American Society of Clinical Oncology, which funded her team to develop the Bridge app. Bridge app, everyone search up Bridge app, very important app to have. And the app is basically to improve referral and reduce delays in diagnosis in breast cancer patients in rural areas. She has published a number of scientific papers, notable of which is the World Health Organization 2022 publication on cervical cancer elimination in Africa, where we are now and where we ought to be. And this was launched in commemoration of World Health Day in 2022. Dr. Jedy-Agba is the founder of the Innovating Health and Cancer Care Foundation, also known as ICANN Foundation, and is a member of the Federal Ministry of Health's Technical Working Group on Cancer Control in Nigeria. So thank you, Dr. Elima. Thank you for honoring us with your presence. You have the floor now. So you can please share your slides. Let me stop sharing while you share yours.
Okay.
Yeah.
Okay, so thank you very much, Uju, for that very kind introduction, and thank you, Priscilla, and thank you to SPE for inviting me to give this talk on a topic that I consider to be really important. Also, I'd just like to apologize that we had to move this meeting from Saturday to today. It was really due to, circumstances really out of my control. I really felt bad about it, but my flight got moved up, and so it wasn't possible to join on Saturday. So apologies. I know maybe there might be a few people who would have loved to join on Saturday and cannot join today. So I'm happy to share my slides after this meeting. Okay, so let me just put this in slide mode. Okay, so can you see my screen?
Yes, Dr.
Yes, yes.
Okay, great. Today I'll be talking to you about breast cancer in Nigerian women. And what you need to know, really. So in terms of screening, early detection, what the treatment guidelines are, and then we can just have a discussion. I'd like it to be really interactive. I'm sure people have come here with questions, and so I'm happy to answer your questions, address any myths that you have heard, with regards to prevention and treatment, and then we can also just talk about what's in the news recently about cancer. Okay, so it's in terms of the talk, this is the outline. I would talk about what is cancer in general, how common is breast cancer, what causes cancer, what are the risk factors for breast cancer, how can it be prevented in terms of prevention, screening and early detection, which is key, can it be treated? And then we can talk about any other issues that the audience would want to talk about. So I'll start off by really defining what cancer is in general. So cancer is an uncontrolled growth of abnormal cells in the body. So you can see from this picture there, you see what normal cells look like, and then you see the cells that are forming a tumor. So when these normal cells, sometimes due to some genetic change, stop functioning as normal and begin to grow in an abnormal fashion, that's when they form a tumor. So old cells usually should die off and new cells should be formed in the body. And so when old cells that should die off don't die, they just keep growing out of control, they begin to form a mass, and that is what a cancer is. So how common is breast cancer? I think Uju talked about that at the beginning, where, there are many types of cancers, and cancer is not just one disease. So cancers are alike in some ways, but they are different in the ways in which they grow and they spread. So cancer can start in any part of the body. It can start in the lungs, in the breast, in the colon, cervix, prostate, or even in the blood. And the number of new cancer cases is on the rise, not just in Nigeria, but worldwide as well. So the most common cancers in Nigerian women are cancers of the breast and cervix, and which is why we're focusing on breast cancer, which is actually the most common cancer affecting women, not just in Nigeria, but globally. So is breast cancer common? I think everyone here can say that it is. Before people, so this is just a quote from Debbie Wasserman School. She's a member of Congress in the US. She's a 15-year breast cancer survivor. And people used to say, everyone knows someone who has had breast cancer. In the past few weeks, I've learned something else. Everyone has somebody close to them who has had breast cancer. So I'm sure if we ask, all those on this call, they would definitely know somebody who has had breast cancer. And that just shows you how common it is. So like I said before, it's the most common cancer in women worldwide. It is also the most common affecting Nigerian women. And what we find is that the number of new cases of breast cancer has doubled over the last decade in Nigeria. And the lifetime risk of breast cancer is 1 in 8, which was reported by the American Cancer Society, that 1 in 8 women will develop breast cancer in their lifetime. So that's really a staggering number, you know, and of all breast cancers, about 5 to 10% of breast cancers are thought to be hereditary. So of course, inherited, you know, they inherit a gene from maybe a mother or, you know, the father's side. And then 90% are due to lifestyle and environmental factors. So again, you know, just how common it is. I mean, this graph just also alludes to the fact that it is the most common. So these are the top 5 cancers that affect women in Nigeria right now: cancer of the breast, cervix, colorectal, ovary, and liver. So the blue you know, line there, or bar rather, just shows you the total number of new cases that we have. And then the red bar shows you the total number of deaths from the cancer. So the good news is that breast cancer, you know, even though the incidence, incidence means the number of new cases, is really high, we can see that at least in Nigeria, we can say that about 40 to 50% or more of the women who come down with breast cancer survive. Now, this number is much higher in the Western world, depending on the type of breast cancer it is and the stage at which the women come. So which is why we're really going to talk a lot about early detection. So the good news is that, you know, for breast cancer, if women come early in stage 1, almost 95% of women who present in stage 1 survive it, right? And so this is quite different for cervical cancer, where you can see that although the numbers, that's the blue bar, are not as high as breast cancer, the people who die from it are much higher than those who die from breast cancer. So I'm just trying to say that breast cancer is not a death sentence. You know, there are people who have had breast cancer and who survive it. And that's why this month of October is really important and has been set aside as Breast Cancer Awareness Month, really to drive home the message. And, you know, a lot of people now are saying that, you know, we shouldn't just drive home this message only in the month of October. It should be something that, given how common breast cancer has become, it should be something we should talk about as frequently as possible. So again, I appreciate SPE for creating a forum such as this, where we can talk about breast cancer and rub our minds together and see what the current trends are and what we can do to prevent breast cancer. Okay, so I'll just talk about the female breast, just a bit about the anatomy. I don't want to make this too, you know, technical, but it's just so that we understand, you know, how it starts in the first instance. So the female breast is made up of the lobules. These are the glands that produce milk, right? And then we have the ducts. So these are tiny tubes that carry the milk from the lobules, where the milk is produced, to the nipple. And then we have the stroma, right? So that's the fatty tissue. That's the fatty part of the breast. And then in the stroma, of course, we have all the blood vessels and the lymphatics that drain the breast. So usually when cells begin to grow in an abnormal way, they can begin to grow that way in the lobules, which are the milk-producing glands, or in the ducts. And so when it starts in the ducts, it's called an invasive ductal carcinoma. So usually when there's a report, that's what will be written there. Or when it's the lobules where the milk is produced, it's called an invasive lobular carcinoma. But in our environment, the most common one we see is the ductal carcinoma. So what causes breast cancer? we talked about the fact that cells begin to grow abnormally, right? And that's with every cancer. The truth is that we do not know the cause of most breast cancers as with other cancers. So I told you that 5 to 10% are genetic. Yes, these women have a family history and they are more likely to have it. You know, and of course there may be changes in the DNA and all of that. But the other 90% are just generally environmental exposures that people may have or lifestyle factors, which we'll talk about in a few minutes. And so if we can try to reduce our risk, okay, by adopting better, you know, lifestyle measures that can help us, you know, reduce our risk, that would also help in preventing breast cancer. But the actual cause of breast cancer, as with other cancers, is not really known. So I talked about risk factors. So risk factors are anything that you can do to either increase or decrease your chance of getting a disease such as cancer. And there are many known risk factors for breast cancer. So these factors are, you know, we call them the modifiable ones, the ones you can change, and then the non-modifiable ones, which you can't really do anything about. So the first one is our gender. Being a woman is the main risk factor for developing breast cancer. So of course, breast cancer occurs in men, but it's very, you know, the incidence is very low in men, although it occurs in some men. So it's not only women that have breast cancer. As long as anybody has a breast, the person can develop breast cancer, but it's not really common in men as it is in women. The second factor is aging. So we find that breast cancer risk increases as a woman gets older. So over 60% of all breast cancers are found in women that are age 50 and above. However, we're beginning to see, you know, and find breast cancers occurring in younger women now who are less than 50. And, you know, the sad thing about that is that because women are not looking out for cancer at a young age, like why would a 30-year-old imagine that she can even develop breast cancer? So she may not be looking out for it. She may not be performing self-breast exam. And so then she may develop cancer. So we are seeing cancers in younger women now, although it's much more common in older women. So just something else to note, that as people grow older, you know, they are more likely to develop not just breast cancer, other cancers as well. So that's, again, we cannot change. Another thing we can change is the family history of breast cancer. So women who have a first-degree relative, so by first-degree, mother, auntie, maybe your mom's sister, you know, sister and all of that, they have a higher risk. So it doesn't mean they will get it. It's just that there's a higher risk of developing it. And just so that these women are more, you know, cautious, and then they take the necessary steps with regards to screening. So anybody who has a family history of breast cancer or any cancer should just, you know, take that extra effort to get screened. Because I think the key thing here really is early detection, which actually saves lives. So a personal history of breast cancer. Sadly, a woman with cancer in one breast has a risk of developing it in another breast. Then I talked about genetic factors. So these are really things that we can change. Other things are reproductive factors. So we find that women who have early menarche are at increased risk. So early menarche is when women see their first period. So people who see their first period quite young, maybe at 10, you know, some people even 9, they are at higher risk. So when we talk about risk, it doesn't mean that they will develop it. I'm just saying that, you know, it's just an increased chance, right? So again, late menopause, and so people who get to menopause late, and then women who do not breastfeed as well, and then late age at first childbirth is also a risk factor for for developing breast cancer. Then I talked about genetic factors before. So there's something called BRCA mutation, and women who have that gene have a higher risk of developing breast cancer. So most times, if there's a family history of breast cancer, it's worthwhile doing a genetic test just to know if you know, a woman has that BRCA gene or not. You know, and then if she does have it, I mean, we've seen in cases like Angelina Jolie, where her mom died of ovarian cancer, and then she decided to do the test, and she found out that she had the BRCA gene, and she decided to have a prophylactic double mastectomy. So she just took out both breasts because she was like, I don't want to wait to find out if I will eventually develop breast cancer. As far as I have this gene, I just don't want the breast to be there. And that dropped her risk from 70% to 5%. So that's just an example of, you know, how some people decide to handle the BRCA mutations if they have them. Now, so we've talked about the things that we can do nothing about, right? And those things really account for less than 10% of most breast cancers. But there are things that we can do something about. And one of those is physical activity. So the less active we are, there's a higher risk of breast cancer. The more active we are, there's a reduced risk. It's clear, it's been, you know, this has been reported in different studies, you know, different researchers across different populations have reported that physical activity can reduce your risk of developing not just breast cancer, but other cancers as well, and other conditions like diabetes. So being physically active helps your health in general. Right? So the second thing is being overweight. I mean, the two are linked, right? The more physically active you are, you know, the more likely you are to be within a good body weight. So we also need to maintain a healthy lifestyle and diet. I mean, the recommendation is that we should have 150 minutes of exercise every week. So if you split that into 5 days, so if you exercise for 30 minutes a day for 5 days, you're within that limit. And of course, you can do more than that. You know, so if you exercise only 3 days a week, you may want to do an hour instead of the 30 minutes, and then you just do 3 days a week, and then you're still hitting the target of you know, of 150 minutes every week. So maintaining a good weight lowers the risk of having breast cancer. And this is especially true in women, you know, above maybe 45, 50 who have reached menopause. The third thing is alcohol use and smoking. So again, that has been linked to increased risk. And that risk really goes up by the quantity. So I'm not just talking about having a glass of wine, you know, after dinner or something, maybe once a week. That, I mean, that's fine, you know, but drinking a lot of alcohol and smoking have really been shown to increase not just breast cancer risk, but for other cancers as well. Okay, so these are things we can modify. Another thing is postmenopausal hormone therapy, and then consistent use of hormonal oral contraceptives. So again, if you don't have to, don't use it. So again, the word there is consistent use. You know, so I mean, if somebody takes a pill, maybe, you know, after unprotected sexual intercourse, you know, once in a while, and takes a pill to prevent pregnancy, that's not consistent use. But if there's consistent use of hormonal oral contraceptives, that's also, that puts women at an increased risk of developing breast cancer. So that's just the overview. So now we're talking about prevention. Now, what can we do to prevent this? And you know, for those of us on this call, or you know, this webinar, as you get this information, it's also important for you to share it with others. You know, I mean, if we, at the beginning, I said that breast cancer is becoming really common. you know, a friend of yours could come and say, oh, I know somebody who, you know, had a breast lump. What do you think? You know, so it's also an opportunity for you to get information to help others who may find themselves in a situation and then they don't have that information. So prevention, be physically active, maintain a healthy weight and lifestyle, avoid hormone use if possible. A bit about chemo prevention, but not, I won't go into that. And then prophylactic surgery in those who have a family history, and really just being intentional about your health and choices. I think, you know, as women, as we get older, we really just need to take control of our health and the choices. You know, I mean, as moms, sometimes, you know, we have our kids eating all the chocolates and all of that, and it's so tempting. You know, sometimes I'm like, oh gosh, you know, but as we get older, we have to really try to be intentional and say, this thing I'm putting in my mouth, like, what value is it adding to my body? You know, if there is no value, then, you know, you may just want to take something else, take the healthier option, you know. So we need to be intentional about our health and our choices, keeping in mind that as we grow older, we are more likely to come down with, or more likely to be at risk, let me not say come down, be at risk of non-communicable diseases, not just cancers, diabetes, hypertension, and others. So I would say that breast cancer screening is something that is really important. And what is screening? This is just simply put a test to find a disease early in people who don't have any symptoms at all. So we don't have any symptoms, but you know, the important thing is that you want to do this regularly so that should anything arise, we don't pray for it to happen, but should it happen, you know, in any woman or family member, it should, we pray that it is found early when something can be done. Because usually when breast cancer is found at screening, a routine screening, it's likely to be very small and still confined to the breast, and it hasn't spread. And the smaller the size, the better chances of survival. So let's talk a bit about screening, excuse me, and early detection. I would say that all women, once we're over 20 years of age, should learn how to do a breast self-examination. And it's easy to do. I mean, there are videos also on YouTube that show you how this can be done. And it's, you know, recommended that this is done every month after the menstrual period. So as soon as a woman has finished her menstrual period, or 1 or 2 days later, you do the breast self-exam. And it's not recommended during the period, because during the period, the breasts feel a bit lumpy. So if there is anything abnormal, you may not find it at that time. So a couple of days after the menstrual period is the best time to do a breast self-exam. And that should be done every month in women who are 20 years of age and over. And I say that because even though breast cancer is seen more in older women, we are seeing cases in younger women now. So every woman, you know, should just do a breast self-exam every month. Then the second thing with regards to screening and early detection is a clinical breast exam. So for women aged 20 to 40 years of age, it's important that a clinical breast exam is done every 6 months or every year. So in addition to the breast self-exam, because sometimes it may be hard for you to pick up maybe a lump that is less than 2 centimeters, really tiny. But if a clinical breast exam is just simply put an exam that is done by a clinician, so it may be a nurse, a doctor, somebody who is a healthcare professional. So that person may be more likely to pick up really tiny ones. So even though we are doing the breast self-exam from age 20, between age 20 and 40 years, it's also important at least once a year to get a clinical breast exam. And I'll just state here too that, you know, again, women, you know, above 30 years of age should really try to have an annual well woman check. A lot of hospitals and, you know, labs offer it now, where you do routine investigations. And this is not just about breast cancer now, but it's about other health conditions. So check out your liver function test, kidney function. It's important to do a well woman check once a year, so that anything that is, you know, wrong can be found early. Then, so moving on from the clinical breast exam to the breast ultrasound scan. So again, this is recommended in women that are age 35 years and above, but from 30, if there's a family history. So remember, I talked about the family history of breast cancer, and not even just breast cancer, a family history of cancer in general. And then also women who have dense breasts, breast ultrasound provides much more information than a mammogram. So moving on, from age 40, every woman should get an annual mammogram. And if there's a family history of breast cancer or any cancer in general, it's important to begin to get that mammogram earlier than 40, from maybe 35. So there are lots of guidelines from different groups about when to get a mammogram, and we can talk about that earlier. So later. So some groups say that, you know, from age 45, others say from age 40, but my recommendation, based on the data that we are seeing from Nigeria, is that it should be from age 40. And then usually, if there is anything abnormal found on mammogram, then they would ask you to do a breast MRI. But that's not done routinely. It's just if there is something on mammogram that is not too clear, and a breast MRI gives a clearer picture of what is going on. So that is it for screening and early detection of breast cancer. And these are the recommendations. Now, so for early detection, you know, I like to say, know your lemons, you know. We all need to be breast aware. So you need to know what is normal for you, right? So that when there are any changes, you can identify quickly. So, I mean, this picture here just shows the different changes that could occur in a breast. So a lump, which is the most common in about 70 to 80% of women, that's the first finding. It's a breast lump. It may be dimpling of the skin, you know, redness, unexpected fluid from the nipple, skin sores, you know, growing like a vein, sunken nipple. There's a change in the size, and shape of the breast, and then like an orange scale appearance. So it's just important that we're all breast aware. So every month after, you know, your period, like I said, just when you're in the shower, that's usually the best time. Just raise an arm, you know, and then just check, just make it normal. Something, in fact, you can even do it being breast aware. You don't have to wait until, you know, it's a month. You can do it every day when you're in the shower, you know, every 2 weeks. Just, you know your lemons and know what is normal and what is abnormal. And as soon as anything abnormal is detected, try to get it checked out. And I'll just say here that over 60% of breast lumps are not cancer, they are benign. You know, so that's the good news. So don't be scared if you have a breast lump. The important thing is to get it checked out early. It may, you know, it may not be cancer. And if it does turn out to be cancer, at least it's early, and at that stage, something can be done. So I've talked about these symptoms already. you know, I think the only one I didn't talk about in the other slide was really the lump in the underarm area, in the axilla. That's the armpit. Sometimes that's the first lump that is noticed, you know, and at that point it has already spread to the lymph nodes. So these are just symptoms that we need to look out for. But like I said, the good news is that 60% of breast lumps are benign. Okay, so I'll just say here that the reality is that, you know, there's no sure way to prevent it, but we can do things to reduce our risk. And I have talked about all the things that we can do to reduce our risk. Okay, so I'll move on now to the stage at presentation. So the stage at which a woman is seen determines treatment and survival. So women who are seen early in stage 1 and 2, over 90% of them survive it, thankfully. And then stage 3, 70 to 80% survive. But when it's stage 4, irrespective of where you are across the world, it's less than 40% that survive stage 4. Stage 4 is when it has spread to other parts of the body. And that is what we do not want to see at all in any patients. So what are these different stages? For stage 1, the tumor is, it's less than 2 centimeters, that lump. And there's no spread to the lymph nodes and no spread to any other parts of the body. In stage 2, it is between 2 and 5 centimeters. And why I'm talking about this stage is that stage really determines the survival and the treatment that would be given. So for stage 2, it is between 2 and 5 centimeters. And again, there may be a lymph node on the same side as the lump, but again, there's also no spread. So stages 1 and 2 are early, and over 90% of women that are seen in this stage survive. In the Western world, over 95% of women that are seen in stage 1 and 2 survive. Then for stage 3, that's when it's really it's big, it's 5 centimeters. I mean, imagine having a lump that is 5 centimeters in the breast. And then for stage 4, it doesn't matter the size. If it has spread to any other organs of the body, the bone, the liver, the lung, and the brain, because those are the 4 places that breast cancer spreads to. And not to scare anyone, you know, of course, we don't pray for this, but it's just, like I said, it's just information for us to know. I think the key takeaway from this stage bit of this presentation is the fact that early, over 95% will survive. Late, not so much. So it's important to present early. And also to note that the breast lump may be a benign breast lump in any case, and it may not require the extensive treatment that is required in cancer. So how is it diagnosed? Usually by a breast biopsy. So if you know somebody who says, oh, I felt a lump in my breast, then you can advise and say, well, I think you need to go and see a surgeon so that they can do a biopsy. A biopsy is where they just take a little bit of the tissue and send it to the lab, and they look at it under the microscope and tell us if it is cancer or not. And if it is not cancer, you can choose to leave the benign breast lump there. You don't have to take it out. You can choose, if it's not bothering you, you can leave it there. But if that result comes back and it is cancer, then that starts the whole journey of treatment. So after that biopsy is done and they say whether it's cancer or not, the next thing would be to do a test called IHC. It's an immunohistochemistry test. And in that test, it tells you the subtype, and treatment is determined by the subtype that it is. For some subtypes, the treatment is much longer than for others. So treatment varies depending on the subtype, and this varies from woman to woman. So what are the treatment options that there are? So one is a surgery, and that surgery can be a mastectomy, which is removal of the entire breast, or a lumpectomy, just removing a part of the breast that's taking out the lump and some surrounding tissue around it. There's also chemotherapy, which is the use of some drugs that target the cancer cells. But chemotherapy has quite a lot of side effects, because as it targets the cancer cells, it also targets the normal cells, and that's what causes the hair loss and some of the other symptoms associated with it. So there's hormone therapy, targeted therapy, radiation, and immunotherapy. So again, this is just to say that there are treatment options. So it's not a death sentence, and it can be treated, especially if it is caught early. So this is the range of treatment options that are currently available. So I'll move on now to, what's in the news, and we can really talk about this. I mean, I'm sure we saw this that was circulating recently about the fact that hair straightening products are linked to increased uterine cancer risk in a new study. So this is something that a lot of people have tried to research in the past. So using relaxers and all that, are they linked to increase breast cancer risk? And I think the jury, was really still out on that in terms of for breast cancer risk. But for uterine cancer risk, there is, this new study has just shown that there's a clear link between using some of these products and not all the products. So what I would advise is that you look out for endocrine disruptor chemicals, so skin, hair products, and food packaging. Try to check what they contain. Something like BPA has been linked to cancer. So if you see any products that have that, you try to avoid using them. So it's important to know that some of the skin creams, lightening creams that women use, hair products, and even some food packaging can put women at increased risk of cancer. So I will just stop here and ask if there are any questions you have, any myths you've heard you would like us to address. I'll hand over to Uju. Let's just take a few questions at this point before we continue. Thank you.
Oh, awesome. Thank you so much, Dr. Elima. I just kept listening. I didn't want you to stop. I was looking at my watch, but at the same time, I was just like, oh, she needs to just keep going. Thank you so much. You really, put out there a lot of insights to cancer. I had a lot of questions. I didn't know so much about it, but, you've really opened my eyes to quite a bit of the things. So I just wanted to quickly, because we're not doing so well on time, and we want to take 1 or 2 or 3 questions, right? So just summary of key points. So, it's been noted that breast cancer is the most common and most prevalent, especially in Nigeria and even the rest of the world. It's been put out there that 1 out of 8 women, has been predicted to experience will experience some form of cancer in their lifetime, which is a huge number. If we look at it, 1 out of 8, in my family, we're 8 children. So that means that one of us, God forbid, that sort of, statistics, which is kind of scary. And then you mentioned that, the stage 1 and 2, breast cancer is, there's higher chances of you surviving. It can be managed, it can be treated and all of that. But once you start getting to stage 3 and stage 4, then it becomes, the chances are, diminishing, right? And, it gets worse for the person, right? So the key thing is to catch it on time, do all the screening, all the tests, all of that, to make sure that, if there's something developing, is quickly seen on time, and then, treatment can start off immediately to try and remove, the growth and all of that. So thank you again. For me, I had a question, because, you mentioned that, lifestyle, contributes to very little, percentage of, the cancer spread or the risk or whatever, And, I was just wondering about the genetics and wondered if for a child, is there any way are there tests that, when, let's say in a family that has a history, right? And then I have a child, is there any way to do a test on the child to see if those genes, I've forgotten what you call them, if they can be detected early? And if they can be detected early, is there some modification? I don't know what you guys call it, pardon me, but is there any modification that can be done, in that child at that young age to sort of remove those genes that are, that are responsible for cancer? I don't know if I put the question correctly, but this is my own layman's way of trying to say.
Mm-hmm.
Yeah.
Okay, thank you very much, Uju, for that question. Excellent question, actually. Yes, so I said that genetics contributes about 10%, and then the other 90% is environmental and lifestyle factors, right? Yes, so kind of the other way around. No, that's fine. So yes, genetics contributes about 10%. And I mean, how would we know? So of course, you rarely see breast cancer in women that are less than, maybe a girl that is less than 15 or 6. So you don't have to bother about doing BRCA testing. But once if there's a family history, and she gets to like 25, it's important that you do that testing for that gene to see if it is there. And it's a gene. So the reality is that not much can be done to get it out of the body. You see what I mean? Because it's a genetic, it's right in the DNA.
Can it be modified?
So what you can try to do is modify your risk, which is now, that you have that 10%, right? From the genetic side, not you, I'm just saying your woman has that 10%. So the other 90% that can be modified, you try to work on that, which is your environmental factors and lifestyle factors, maintaining a healthy weight, diet, and all of that. You can't totally obliterate the 10%. That risk is still there. So which is why you would have to, even though you're modifying your other risk of, exercise, diet, not smoking, but you would still need to be doing your breast exams and screening, so that should it happen that cancer comes, it is caught early and can be treated.
Okay, thank you for that response. Thank you. So we have a couple of questions in the chat box. I don't know if one or two people also want to speak. If you want to speak, please kindly raise up your hands, but I'm going to read out one or two of the questions here. So Magdalene was asking, what age range is considered late for menopause?
Okay, that's a good question. So there is no, what I would say is, I think that's menopause as a risk factor. It really stems from the fact that the longer we are exposed to hormones, because some breast cancers are driven by estrogen. So the longer women are exposed to hormones, so for example, you have an early menarche, which is the first period, maybe at about 10. And then menopause is at about 55. So you see that woman has been exposed for 45 years to estrogen. Right? So that puts her at increased. But if it's a woman who had her first period at maybe 15 and then went into menopause at maybe 45, her lifetime exposure is shorter. So that's really it. So there's really no hard or fast rule about the exact age. It's just that long duration of exposure to hormones.
Okay, thank you. And Magdalene was also wondering as well, just in continuing on the menopause question, she also wanted to know what time of the month should she carry out breast examination for women that have reached menopause? Is there any particular time in the month,
That's a very good question. And what we advise is that usually pick a day. So because you've reached menopause, there's no period, so you're not having those. So pick a day, like say the first of the month, and you stick with it.
Okay.
So just pick a day if you want to pick the first of the month or the middle of the month, maybe like the 15th, and then you stick with that. So that's the recommendation for women who have reached menopause.
Okay, thank you for that. Odrak was wondering, what is the exact age of being at risk if late age at first childbirth is one of the risk factors? Did you understand that?
Yes.
Exactly.
Yes, so I mean that's something that we can't again, it's one of the things that we can't do much about, right? We don't know, when. I mean, we all growing up, we all have how will I put it now, wishes or as to when we want to get married, have our first kids, say, oh, I want to get married at 25, I want to, so sometimes in life, things may not happen that way. And then we find women getting married at older ages now. So if you're having a woman who has not had any kids up till like 40, right? That's an increased risk. And again, it has to do with that issue of, because when you have kids, right, you go through that 9 months of being pregnant where you're not seeing your period, right? And then of course you're not having that regular monthly surge of estrogen for the cancers that thrive on estrogen. So I would say from like 40, that's but again, all of this, like I said, remember, it's just about risk. It doesn't mean that women who are 40 and have not had kids will have breast cancer. No, we are just looking at the risk factors. There are women who have not had kids, they are 50 and they're moving about, so it's just some of the things we've seen from the studies that we've looked at and the data.
Okay, cool. Thank you. Thanks for that. I think I have okay, 1 or 2 more questions. So Udrak is also asking, can mastitis cause breast cancer?
Okay, mastitis. So
Oh.
yeah, mastitis is is just an inflammation of the breast, and in most cases it is not. So what we find is that mastitis is painful, right? So maybe the breast is inflamed and then it's painful. Most likely it may be an abscess, it may be an infection, it may be other things. So usually the lump in breast cancer is usually a painless hard lump. It's painless. Mastitis, it will be painful. Sometimes there may be trauma to the breast, you may hit the breast or what, and then, develop mastitis or an abscess, and then it will be painful. But most times for cancer, it is a painless breast lump.
Hello, Ju, you are muted.
Oh, sorry about that. So the last question from Tosin is asking, can the use of family planning contraceptives like implants cause breast cancer? Did you hear me?
Hello?
Yeah, did you hear me? Hello?
Okay, 1 second. Yes, I heard you.
Okay.
Okay, so usually for family planning contraceptives, I would say no, I would say no. And why I say that is that a lot of studies that have been done to look at this have not shown any that it really, what is clear is hormone replacement therapy and oral contraceptive pills. Those ones, there is evidence to show that they increase risk and not for implants. So for example, like the Mirena that is implanted to prevent pregnancy, where it's inserted, even though it contains a hormone, it's really low dose and low releasing, and it just acts locally in there, so it doesn't increase risk. I'm just using Mirena as an example. So the literature doesn't point to the fact that these implants increase, except if women don't use it as at how it should be used, because sometimes they put implants, they'll tell you this implant is for 2 years or it's for 3 years, so when it is 3 years, take it out. But if you keep it there for longer than the time, that's when you're putting yourself at risk.
Okay, thank you. Thanks for using Mirena. That's what I have. So I'm just happy to know that it's still on the safe side. Thank you.
Yes, it is.
So the last comment is basically a suggestion, and the Fuller was wondering if maybe in the future, if you would also like to share a short video of how to do the self-exams, because sometimes, he or she probably wonders if she's doing it right. So I don't know. Maybe it's feedback for you.
Okay, thank you. That's a great suggestion. Yes, absolutely. Next time I would share a short video on how to do a breast self-exam and how to. But I mean, I can just explain if there's time.
Maybe a quick explanation again.
Okay.
Yes.
So I mean, the first thing to do usually is to stand, in front of the mirror. Put your hands on your waist and just look. So the first thing really is to look, because when you look, you just see any changes either in the shape, in the size, in the nipple. Just by looking, you would see, and then you kind of push your shoulders up just to see if there's any, exactly. So you just look. Then after that, you can then lie down, because that way the breasts are spread out and it's a bit easier to feel if there's anything, especially for women who have bigger breasts. So one hand raised, the side you want to check, you have to raise up that hand. Yeah. And then you kind of divide your breast into 4 sections, quadrants. Oh, thank you. I like it. You're speaking the language. So you divide into 4 quadrants, and then you start from the first, and you just check, touch it. That's by the time you do it, everyone, if there's anything that is not normal there, you will, trust me, you will know, So that's why we talk about breast awareness. Just be doing it. So you just go around the 4 different quadrants and just press, check. Then when you finish, you now squeeze the nipple to see if anything is coming out, if there's any discharge or anything. And of course, sometimes when women are breastfeeding or immediately after breastfeeding, there may be milky discharge that has nothing to do with breast cancer. And sometimes the milky discharge may just be hormonal, hyperprolactinemia, and of course there are treatments for that. So again, all these things we're doing is not just only about breast cancer, it's to find any other thing that just may be wrong and that could be addressed quickly. So press the nipple and then check if there is any discharge, and then you move on to the other side and do that. But also on that side, after checking the 4 quadrants of the breast, it's also important to check under the arm, because remember I said that sometimes a lump, would be in the axilla, which would be a lymph node that has drained. There are lymph nodes that drain the breast, and sometimes it may spread to the lymph nodes. And if you're not certain, then after 6 months, please get a clinical breast exam from a medical professional. A friend you have who may be a nurse, doctor, that can also just check and be sure that nothing is wrong. And I also stress the need for a well-woman exam, which would include all of this anyway, at least once a year. Let's be intentional about our health and try to ensure that we we have these regular health checks, not just us, let's tell our husbands as well, you know, to do that. For men, sorry, I just have to drop this there. Men who are 45 and above, please let them, you know, colorectal cancer is becoming too common now. Let them get, you know, a colposcopy. Men who are above 60 for our fathers, you know, and all of that, let them do PSA testing, prostate cancer, because early detection across board for all these cancers is really what saves lives.
Perfect. Thank you so much, Dr. Elima. We are so grateful. I mean, you've really, you know, given us a good dose of knowledge on cancer. I particularly am very happy for this because, you know, I've just been lazy trying to read up on it, but now I think I know a lot more about it than, you know, than just a few hours ago. So thank you so much for your time. Thank you for gracing us. Before we finish up, let me quickly put up my own slide. Dr. Elima, is it okay to share your email address in case someone has further questions?
Please, I'm happy to address any questions. And there's a last comment I just saw in the chat, which I think is important to address from for Ezejanu. If you're breastfeeding, how can you check? Yeah, so it's often difficult to check when you're breastfeeding. That's a good point, because breasts are lumpy, you know, so that's where you really need a clinical breast examination. To be honest, self-breast exam when you're breastfeeding, you may pick up things that are not breast cancer. You just be becoming paranoid, you know, that kind of, you know, so it's important to at least have a clinician check and see. It's important. And if you do feel there's something that is just not right, you know, again, it's from being breast aware and doing all of this consistently, and you feel there's something that's just not right, then it's worth
checking out. Okay, thank you. I just wanted to point out that the men are appreciating you for not leaving them out as well.
Okay.
Thank you so much. Thank you for that. Okay, I don't know. I can't see any more comments or questions. So I don't know if you can see any more. I don't see.
I think that's all.
Okay, so let me quickly share back my slide just to try and round up. Okay, slide, are you going to work? Yeah. So again, we just want to thank you once again, because it's not easy to make out time. And like you said, you were in a conference and you had to make out time for us. So we appreciate you and say a big thank you. We hope that in the future you partner with us some more to further enlighten us, you know, and the population on, you know, many other topics that that is of interest to you. Okay. And yeah, so just a quick announcement. So we have tomorrow, Friday at 10 a.m. We SPE Lagos section, we're particularly proud and happy that the project we started sometime earlier this year. So it's a solar power project for a school here in Lagos. We're happy to announce that, you know, it's ready for commissioning. And we're really excited because, I mean, it was such an uphill task. It took a whole lot of, you know, super will to get this project started. And we're glad to announce that tomorrow, Friday at 10 a.m., we're going to be commissioning the project at Kennedy Private School. Is located in Makoko in Lagos. If you need details of the location or how to get there, you can also contact the section admin to give you directions on how to get there. Secondly, we are having one of our big events, our symposium. And for this particular one, we are looking at crude oil theft in Nigeria. And the topic is unpacking crude oil theft in Nigeria, effect on the economy and sustainable solutions. And this is going to be a virtual symposium. It's going to hold on the 29th of November, 2022, as in a couple of days' times. And it's going to start from 10 a.m. to 4 p.m. Okay, so please do join us again. as we speak on crude oil theft, which is one of the big issues that is currently ongoing in our industry. And finally, just to share with you in terms of that you should please connect with us, Lagos section on LinkedIn. You can easily find us on LinkedIn, on Twitter, Instagram, Facebook, and even on YouTube. And these are our handles for each of the different social media platforms. And for membership, this is that time of the year when we are renewing memberships. Please contact the section admin, Ojion, or LSE, who is a membership chairperson, or Adewale, who is the co-chair for membership. Please contact them to get your membership renewed if you are still lagging behind. And finally, for membership benefits, also visit SPE.org, and you can find some information from there. If you also need to reach out to any one of us, please feel free to do that. Okay, just before we turn off, Dr. Elima, I hope you've not gone, please. We'd like to have a photo session if that's okay. So for everyone on the call, please could you put on your cameras? Let me open up my the bigger
and
view.
just say I'm on Twitter and Elima one, and on LinkedIn as well. So
okay, Elima one.
Yes, and on LinkedIn, Elima Jedy-Agba, you can see my work in cancer research and what the what's new in the field.
Oh, perfect. Are you able to put that in the chat box for us, please, so we can take it down?
Okay.
Yeah. All right, guys, please, could you turn on your cameras? I see a few people already turned on. If you want to join us in the photo session, please turn on your camera, please. I see my sister. Hello. Okay, in the next 1 minute, Ojon, are you ready? I don't know if others are going to join us.
Yes, I'm ready and I'm good to go. Just waiting for a few others to join. Please kindly. Okay, I think some of them are just putting on their makeup, trying to look at the best angle, best side. Typically how a photo session goes. Okay, all right. I will do a countdown: 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And I'll just click away. Let's smile. Let's smile. Thank you. Let's smile. Thank you very much. Okay. Okay. All right. So these oil and gas SPE, no, you have to do that. This is this is a different topic for yeah. So over to you, Ju. Yeah, thank you very much.
Okay, thanks, Ojon. Thanks, everyone. Thank you so much for joining us today. Please keep supporting us and join our future events as well. Take care, everyone, and enjoy the rest of your day. Thank you. Thank you. Bye.
Thank you, Ju.
Okay. Bye,
everyone.
Bye.
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 All right, countdown to this link coming to an end in 5, 4, 3, 2, 1. Thank you all.